Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back. We are here for another brand new episode of the Hope Natural Health podcast. Last week, we discussed why your food matters with a guest, Carrie Jenkins. So take a listen to that if you missed it. And this week, I'm going to talk about 3 factors to weight loss. This is a common topic I have almost daily with my patients, and I actually just had this conversation briefly with Bill, my podcast host, right before we started recording. So he's going to be listening intently to how he can help himself lose weight, but I wanted to bring up these 3 factors to weight loss because they all need to happen in order for us to lose weight. So first is exercise. We all know that exercise is important, but I want to let you know that it doesn't have to be crazy, intense, high interval, boot camp type training. You could simply move the body by doing walking. You can do yoga. You can do Pilates. You can do things that are a little gentler on the system. But exercise needs to happen for us to lose weight. We have to move the body at least 30 minutes, 3 to 5 times a week. I try and get out. Well, if you follow me on Instagram, you know I'm out every morning with the dogs because they won't take no for an answer. But I try and move the body at least 3 to 5 times a week. I'm out there obviously every day, so I am moving the body daily. So I recommend that you do the same. And again, it doesn't have to be for hours on end. I think that actually might, be hindersome to some people and hurt our adrenal glands and take stress on our thyroid. So keep that in mind. Just try and move the body. And if your body isn't feeling like doing a crazy workout, just go walk. I know it's insanely hot here in Arizona, but if you get out early, even later at night, the standing walking desks at your desks are actually pretty popular. So jumping on a little trampoline, whatever you can do to move that body. So exercise needs to happen. The second thing would be hormones. We need to make sure those hormones are imbalanced. Our hormones are balanced, not imbalanced. They usually are imbalanced, and that can cause hindrance in losing weight. So we want to make sure that all the hormones are working well together. That's your thyroid, that's your adrenal glands, that's your reproductive hormones. For men, it comes down to really 2 hormones, testosterone and cortisol. Testosterone is their primary driver, and cortisol is affected or can be affected by both men and women, and that's our stress hormone released by our adrenal gland. And, is released when we're under stress, fight or flight, go. Scary times, like we have that surge of adrenaline, that's cortisol is being released. So our adrenal glands play a role in weight loss. Our thyroid definitely plays a role in weight loss. And our reproductive hormones play a role in weight loss. So making sure that you get a comprehensive look at your lab work to see where any imbalances might occur, and there are ways to fix them. Also with the hormones, I'll throw in there our blood sugar. Do we have a high amount of insulin? Do we maybe have a higher than optimal hemoglobin A1C? Maybe our fasting glucose is a little bit higher. This all plays a role in weight gain and also the inability to lose weight. I have several podcasts on insulin and intermittent fasting and things like that can help control insulin if that is the case for you. Also, insulin does play a role in hormone health for women. So making sure that you do ask your doctor for insulin and blood sugar when you're asking for labs to see, how your hormones are balanced. With hormones too, if you have for reproductive hormones, if you have a higher amount of estrogen in comparison to progesterone, that can cause bloating, water retention, and therefore weight gain. So a lot of times women think like, well, I'm just so bloated and it has something to do with food, and it's not always food as the culprit. It could be simply the hormones. So why I am such a fan of getting lab work done and, making sure that it's comprehensive. A lot of times most of these factors are missed. So if you don't have access to someone to run labs, we have wellness testing you can order at your house on our website at hopenaturalhealth.com, or search in your area for a functional medicine provider or naturopathic doctor. And I can always help you online as well, too, virtually. And the third component that's very important, and usually there's half of this that's right with most people, is diet. And the half that's usually right is that they're eating well. The half that's incorrect is we're not eating enough. And we as a society have been taught that the less that we eat, the more we're going to lose. And that has some validity in the beginning, but then your body is a very smart organism. And it's like going to figure out really quickly that you are starving yourself and starving the body. So then it will hang on to everything that you're feeding it and store it because you're not feeding the body enough to do what it needs to do. So with diet, obviously comes calories, and that's what I wanted to focus on with this aspect, is making sure that we're eating enough. Most every single patient that I see in office is under eating, and it's because of what we've just been told for our entire lives. And we're thinking like, well, if I eat more, I'm going to get fat. Well, we actually need to eat to lose weight. And I have been tracking my macros, which are carbs, protein, and fat, for 7 months now, 8 months now. And I started with a pretty lower amount of calories than I should have been eating, which was why I wasn't seeing the scale move. I was exercising and my hormones were balanced, so I knew it had to be calories, which I was completely 100% accurate. But since I've been tracking since September, October, I started around 1,400 calories, which is really low. And now I'm cycling between 1,800 to 2,200 calories. So that's a giant jump, and that's a lot of calories. So it's based on height, it's based on weight, it's based on energy expenditure. And I don't recommend trying to figure it out on your own. And I do not recommend putting in your demographics or the metrics into MyFitnessPal, because it's probably going to tell you to eat 1,200 calories, which is really low. What I do recommend is starting a diet diary and tracking the foods that you are eating and really paying attention to how much protein you're getting. Carbohydrates we need, even though they have a bad rap, but we really do need carbohydrates, and we really do need fat, and we need good, healthy fat. So we need all three of those macronutrients. So that's what I would recommend, is starting with, what are you eating? How much are you consuming? Are you eating very low protein? Are you eating way more carbohydrates than you might think that you are? And that's where tracking foods can be super helpful. You don't need to do it long term. I do it because it's holding me accountable, and I really enjoy it. And I'm seeing the results, and now it's becoming a second nature as part of my day, is to track my foods and log them in and say, all right, well, this is what I'm eating today. It honestly takes the guesswork out of my diet and my nutrition and what I'm going to eat for the day when I spend time to plan it out. So with weight loss and the diet, again, you need to eat based on your energy expenditure. So we have something called our basal metabolic rate, which is about the calories that your body needs if you were to do nothing. That means like you're literally laying on the bed doing absolutely nothing. It doesn't account for any energy that you expend. So then we factor in calories based on how much energy you expend, how much exercise, or how active you are. So the more you're active, the more calories you actually need. And then that is added into your basal metabolic rate, but that would be just to maintain the weight. And nobody really wants to maintain their weight unless they're actually, pretty happy with where they are. But most people have weight loss in mind. So we actually then will take a deficit from that higher number. And I think that's where the misconception comes with weight loss, is that, it's like, oh, the less we eat, the more we're going to lose. But we have to factor in the calories that our body needs to do what it wants to do. So that's pretty much how I approach weight loss with calories. I help women look at their diet diaries and make adjustments, and making sure that they're getting balanced meals of carbs, protein, and fat, because women are notoriously under eating protein and eating way more carbs. And the other thing with the diet too, and the calories, is that we're eating most of the calories, 2/3, if not more of the calories, at dinner time. And that's because women are so busy. They're just go, forget to eat, taking care of the kids, going to the job, picking up the kids, whatever the case may be. And then by dinner time, they're starving, and they're trying to pack in all of their calories at dinner time. So that's where we have to plan prepare to plan. So you plan out your day and you have, easy grab and go things, or you meal prep, or you use a meal prep service. I'll do a couple plugs for those that I like. I've used Gains on the Go for over a year. Love them. I've recently been using Fit Choice Foods, another really, really good option. And I'm really excited for Fresh Prep, who's coming to East Mesa here soon. They're just waiting for their permits, but that's going to be another option. I'm all for trying to make my life as easy as possible. And most of these meal prep companies will give you the macronutrients on their foods, which is the protein, carbs, and fat, and how many calories, so you'll know that it's a pretty well-balanced meal. So again, that makes my life so much easier to have my lunches and sometimes dinners just ready for me. So I just have to fill in my breakfast and snacks, which I rotate between very similar things day in and day out. So just to recap, 3 huge factors to weight loss. We've got our hormone component, which is our thyroid, our adrenals, and our reproductive hormones. We need to make sure we're moving that body. And then diet, and not necessarily the foods that we're eating, but the calories that we're consuming, and making sure that we're eating enough. So hopefully this was helpful. And if you're not seeing the scale budge, or if you're at a plateau, it's probably due to one of these 3 reasons. And I'm always here to support you. And if you have any questions, feel free to reach out. I do offer 15-minute discovery calls, so you can find that information on our website. But again, let's lose weight, and let's lose weight the healthy way. I'll see you all again next week.